Hi, class. My name is Liz Laura, and
This is
uh,
Jessica.
and we are going to present the state insurance exchange. Uh, our scenario is there is this uh, person who's 27 years old and single, and he can not longer be covered under their parents' insurance. He also can qualify for Medicare or Medicaid. And he says he enjoys hobbies such as rock climbing, diving, motocross, tennis, and he feels like he needs a health insurance coverage. So he knows that the state offers insurance exchange, but he doesn't have any clue or any information about it. So we're just gonna talk about his options. So since live in Utah, I'm gonna do the how we do it in Utah and how to enroll it. So the enrollment in Utah is from November 1st to December 15th, and there are different ways to apply for health insurance. The first and the easiest one is to go through healthcare.gov, and there is a lot of information right there. Or if I don't have computer right now, I can always call to 211 and they will give me a lot of information about it. And there is a lot of another website that we can go, and it's takecareutah.org. And they have a live chat available from Monday through Friday from 9 a.m. to 5 p.m. And we can also find a person who can help us with all the information, or who can help this person or any person with all the information. So we're going to the next slide, and then there is if for some reason you weren't able to enroll during the enroll time, we can do it if um, we if you got married and then um, you lost your health insurance, or you have a baby, or you adopt a baby, or you got divorced, or for some reason your partner, who was the person who insured you, died, you can also qualify. Or if you change your residency, you can also do that. Or if for some reason you lost your health insurance by losing your job or Medicare eligibility. On to the next one. And then Utah has different types of plans, and they call them metal plans. And the bronze plan, they're lower premiums, higher costs when you need care. The silver plan, it's a moderate monthly premium, moderate cost when medical care is needed. The gold plan, it's high monthly premiums, low cost when you need care. And the platinum is the best one, but it's the highest monthly premium, but when you need healthcare, it's gonna be a low cost. I don't, for some reason, my little picture there, it doesn't, uh, the numbers we can see it pretty well, but it's the bronze is like you the insurance covers 60%, and then you pay 40%, and then the silver is 70% and 30% gold, 80%, 20%, and the platinum is 90% and 10%. So I try to see if I can check my premium. So when I went to the website, it was kind of funny because it didn't give me the premium. It's according to your income, to the individual income. So I was with my daughter, and we put or my information, and my premium was pretty high. And then when my daughter put her information, her insurance was pretty low. So it depends on your age, it depends on your individual income, and then where you live too. So it just go by individual. It's how they do it here in Utah. So we'll go to the next slide. And Utah Health, it's provided by Select Health, University of Utah Health Plans, and Molina Healthcare. That's the three we use here in Utah.
Somebody shoot it at me.
And there is some types of marketplace plans here in Utah. And the first one is the Exclusive Provider Organization, EPO, and the Health Maintenance Organization, HMO, the Point of Service, POS, and the Preferred Provider Organization, PPO.
Ow! How'd I got hit by like a headshot.
Okay, so the healthcare exchange for insurance in California, just to kind of compare and contrast with Utah, is called Covered California. It's the federal government's the response to the ACA for California. You can access information online, by telephone, and in person. And the plans that our Governor Newsom has been talking about is that Covered California will survive beyond any repeal of the ACA. It's expected to be fully funded by California if that ever happens. And then there's also plans that Governor Newsom is talking about to expand the availability of the coverage to even more individuals, namely more low-income individuals, and those undocumented immigrants are also intended to be part of that. Some of the primary contracts are Blue Shield of California, Anthem Blue Cross, Kaiser, Aetna, HealthNet. There's a few more. So how to enroll. Open enrollment for California is October 15th through January 15th. And over the past few years, it's actually extended beyond that because I think there's such a high volume of population in California that they just need more time, even on Covered California's end, to process all the enrollees. So qualifying events are similar to in Utah. If you have a marriage or a divorce, you adopt a new child or have a new baby, if your disability status changes, let's say you're on disability and get Medicaid or Medicare for a period of time, even Medi-Cal, that's California's version of Medicaid, but then you're no longer disabled, then you can be eligible for different coverage under Covered California. If you change jobs, you're also eligible to enroll, or any other change of coverage. So in our scenario in particular, it was what we would consider a change of coverage because they can no longer be covered under their parents' plan. And then the ACA mandates that only when you're looking for premiums, it should only be your age and geographical area that are covered. And so that's where California limits their requirements. Like Litz mentioned, it's a little bit different in Utah. They still look at specific incomes as well. But we're going to jump onto the Covered California website really quick just to kind of give everybody a clearer picture. So here's the website. It's pretty user-friendly, very clear. If you do not have coverage yet, you can come over to this tab called Get Coverage, and then it kind of gives you a summary of what kind of coverage you're looking for. We're just going to jump down to the health insurance, and I'm going to do this kind of quick, but you can see. So it kind of gives you a summary of all the basics, what insurances you can be eligible for, all these different things, the format. I want to go over it kind of quick. So we're going to go over, let's see. I lost it.
There's barely any math though.
There is a way, I don't know why I can't find it right now, but there is a way on here that you can go and get a quote. Where did it go?
How did they get to that?
Here we go. Shop and compare. So this will jump you over. It'll ask for the coverage year. It asks for your zip code. I'm just going to put mine in. And then an average income here, we'll say it's like $20 an hour. It's about $45,000 roughly. We're just going to say it's the one individual. And then the age is 27.
Okay.
And we're just going to say over here on the right, you can see what type of coverage. Do they just need coverage? Is someone pregnant? Do they have a special disability? And based off of our scenario, we're just going to look for someone that just needs some coverage. And then this is just kind of a disclaimer that they throw up. It's not on actual applications. It's just where you can get quotes and kind of an estimation of your coverage. It asks a few more follow-up questions just to verify.
What happened to the other three?
And now I'm going to preview some of the plans. I'm going to search for a hospital. There's lots of options with Covered California, which is kind of cool. Since the scenario is saying it sounds like this individual is more likely to look for coverage for emergency or accident type of care. And I'm going to narrow this down to about 50 miles just based off of the area I live in. That's usually where the more where you would do your motocross or your hiking is within that area. And then we're going to go low use, just kind of assuming in the scenario that the person's pretty healthy. Again, just looking for a coverage, partly because they have to have it. You know, if they do get in a bad accident, they want to make sure. Low use of prescriptions, maybe like a prescribed vitamin or something like that. And then we can go look at the plans. And these are just a bunch of samples. They're divided by the metal plans, which I'll kind of describe a little bit more how they work under Covered California as well. But they also follow the metal, bronze, silver, gold, and platinum. But you can see what the monthly payments are for these. They tend to be pretty expensive per month compared to what I've heard from other situations. But the same layout, depending on the amount of care you want. So this is a really cool thing. You can, there's the options, like you can see, you can click to compare, you can get more details, you can add it to your cart if that's the coverage that you want. And then once you move to your cart, it gives you the opportunity to fill out an application and it asks for more details there. So we'll jump back to our PowerPoint now.
And then I have a question. So when you submit, because that's what happened in Utah health insurance too. When my daughter put the submission for her health insurance, they took like 48 hours before it was approved. Is that the same thing in California? Because I think they check their.
Yeah, I think so.
They probably do, right? It's like 24 to 48 hours too.
Yeah, it takes some time.
Mm-hmm. Okay.
Okay, so we'll come back over here. So types of plans, this is kind of another summary in general of the types of the metal plans. This is a little bit more detailed about Covered California, but it is similar to the way it's done in Utah. The Platinum plan, it's the most expensive. You're going to pay your highest premium, but there's no deductible and you have really low copays. And then your out-of-pocket maximum limit is the lowest for the Platinum plan. So ultimately, you'll be paying about 10% of the total healthcare costs. This is typically recommended for people that spend a lot of time getting healthcare. Maybe they have a chronic illness, they have expensive prescriptions, maybe they're being treated for some kind of disease, things like that. The Gold plan is the next level down. It's not quite as expensive. The star ratings on these made the Gold plan the least popular. I think it's probably because your copays are a little bit higher than the Platinum plan, and your out-of-pocket is higher, and you pay 20% of your total costs. So that's the Gold. The Gold plans are typically like that. Silver plan, there's 4 different types. I focused on the Silver 70. There's 3 different ones that have a different percentage that the provider covers for costs. But this one, the provider covers about 70% of costs. You have a $2,500 deductible and that's for individual coverage. You can see the doctor visits are getting a little higher. Prescription costs are about the same. Hospital costs are 20% after your deductible, and your out-of-pocket max is a little higher in the Silver plan. The Silver and the Bronze plans tend to be the most popular in California. The Bronze plan is probably likely the best fit for the scenario situation that we have. There's 2 types, the Bronze 60, so the provider covers 60% of your costs, and the Bronze high deductible health plan with the HSA. This is the one with the lowest premium per month. It's the most popular. It has a higher deductible. Doctor visit copays are going to be higher, but it's limited to the first 3. And then you're responsible for all of your hospital costs up to the out-of-pocket maximum. And the out-of-pocket max is the same as the Silver plan. And so a person being covered under this would be about 40% of the cost would be what they would have to pay. So again, here's the types of plans, the providers. Anthem, Kaiser Permanente is the HMO plan. Anthem and Blue Shield are kind of hybrids. They'll do a little bit of both PPO and HMO. Health Net's an HMO, and all of the other plans are similar. I noticed that Molina Healthcare also provides coverage plans for Utah too. And then after ACA is repealed, what's next for Covered California? Like I mentioned before, Governor Newsom is planning to maintain Medi-Cal and expand the Covered California marketplace.
Oh my gosh.
Some more impacts, just kind of how it reflects the Covered California. Because of the mandates for the ACA, it's kind of a huge infrastructure to change. And I assume this might be a little bit similar to Utah. But the question kind of stands, will major providers of insurance pull out of the Covered California contracts? Because that could potentially mean that their risk pools shift more to the high risk dense populations. Right now under Covered California, because there's a requirement for everybody to have insurance coverage, your risk pools are pretty evenly spread. So you have healthy people that have coverage and with the same providers that people who need more health care do. So because there's just so much work, that all these websites that are being created, all these marketplaces, it's changing, more managed care focus. Pay per performance has been really big. The lab I work at just had to set up an interface with a couple organizations in California to track the quality of the pathologists that I work with. And so they end up getting reimbursed by the state based off of the quality of their care, and not just the quantity. And I think that maybe if ACA gets repealed, there might be some backlash from a lot of enrollees who would lose their coverage because of whatever rules the providers would change back to that they're getting with the ACA.
Mhm.
And that's all that I had. Leets, do you have anything else you wanted to add?
I think we're all set. Thank you so much.
All right. We look forward to your questions on the discussion board.
All right. Thank you.